Hello and welcome to the Patient-Centered Care for Chronic Disease use case. My name is Katie Kurfürst with Cerner. I'd like to introduce you to our patient, George Bench. This gentleman lived a very active lifestyle prior to his retirement in 2016 from the Postal Service in Winona, Minnesota. Once he retired, George became increasingly less active, particularly when he and his wife moved to Chandler, Arizona, where unfortunately he didn't deal too well with the heat. As a result of the decrease in activity, over the course of a few years, George was diagnosed with hypertension and hyperlipidemia, and a few years later, he received a diagnosis of type 2 diabetes. George's PCP and staff have worked diligently with him to help him understand and help to manage his chronic conditions, but unfortunately, George has struggled to remember to take his medication. Additionally, with the COVID-19 pandemic, George's mobility became even more limited due to quarantine, and his condition deteriorated quickly. Today, we catch up with George after his PCP has referred him to home health to help him take better control of his chronic conditions, including improved medication and disease management for increased mobility. And from there, I'll turn it over to Carrie.
Thank you, Katie. Hello, everyone. My name is Carrie Harpel with MatrixCare, and I'm representing the home health in the use case. We pick up after the home health has received and processed the referral. And lucky for George, his previous PCP is connected to the Commonwealth network, so the home health agency can access those previous visits, including diagnoses, medications, allergies, etc. So during the intake process, George is enrolled in the Commonwealth network, and his demographics are matched using the auto-linking service to past care locations. The summary view in the enrollment application will display all of George's existing links where he has previously been seen. The home health can simply click on one of the locations, and they will see associated documents that are available to them. And this uses HL7 Fire to query and retrieve these documents. By clicking the by clicking the document, they're able to pull the document into the system to either be reconciled in the back office, or it can be sent out to the point of care for the clinician to reconcile in the field at the bedside with the patient. The home health agency is able to query and retrieve information from Commonwealth anytime during the care of the patient, and is also able to contribute information for others in the care continuum to receive. After 3 weeks of care and rehab by his home health team, the home health nurse feels that they need to continue through the new year. In tandem with all of these health issues, George and his wife are also in process of changing their Medicare Advantage health plan. And unfortunately, their PCP is out of network, so George has chosen a new PCP and is concerned that his home health information will not be accessible to him or to his physician. At this point in the story, I will hand off to Justin at CAQH, who's going to show us how the information will be available to both of them.
Great. Thanks, Carrie. My name is Justin Edelman, and I'm with CAQH. Today we'll be talking about OneRecord as well as the CAQH endpoint directory. So thankfully, using OneRecord, George is able to request information from his old plan to provide to his new plan and to his PCP. He's able to show that a face-to-face visit occurred and that home health was approved, which ensures that home health services can continue for George. With the CMS final rule on interoperability and patient access, health plans are now required to share patient data via FHIR-compliant APIs. This is a unique opportunity for patients like George to be able to access information their health plans have on them through trusted patient-friendly apps. In this case, George is choosing to use OneRecord to access his information for Medical Mutual. Let's follow along as George logs into OneRecord, where he can pull in data via Commonwealth from providers as well as data from health insurance plans. So I'm going to log into the OneRecord app using George Bench's credentials. And we're going to navigate over to Connections. Here we want to click Connect to an Insurance Portal. and then add insurance plan. You could see a number of health plans here that that One Record can pull data from. In this case, we want to select Medical Mutual, which is George's plan. You'll see using OAuth, George is asked to enter his information so that he can log in and pull his medical records. So since we've already made the connection to Medical Mutual, you'll see no new records come up here, but we'll take a look at his existing records in just a moment. So we're going to navigate over to the Activity tab, and here you can see a full view of all of George's health information. You can see conditions, immunizations, allergies, and so on and so forth. In this case, we want to take a look specifically at his conditions. You'll see in the notes that there's that referral to home health, which George can share with his PCP and his insurance plan to ensure that home health services can continue without any interruption. So now we're going to change gears and talk about how One Record actually made the connection with Medical Mutual so that they were able to pull George's data. So I'm going to navigate over to the CAQH endpoint directory. The endpoint directory is a directory of health plan FHIR APIs, as well as apps that would like to connect with those APIs. So we're going to navigate over to the application profile first. And this is coming from the perspective of One Record. So you can see in the application profile, One Record has uploaded information about their app, previews of the workflows. They're also able to show that they've attested to the Karen Code of Conduct and that they have their ENAC accreditation. They're also asked to fill out a variety of security questions so that health plans are confident and their members are also confident that their data will be protected and that everything is secure. So after One Record finishes filling out their application profile, we could take a look at the directory itself. So we'll click on the organizations here, and you could see a number of health plans that are sharing their FHIR endpoints. In this case, we want to click on Medical Mutual, and we'll navigate over to their shared endpoints. Because we want to pull George's data, we want to look at their their patient access API specifically. So we would send a connection request, and then Medical Mutual would be notified that One Record wants to connect. They could share credentials and then begin sharing data. So that's how Medical Mutual was able to connect with One Record and how George was able to get his data. Now I'll pass it over to Jonathan.
Thank you, Justin. My name is Jonathan Oladitan, and I'm with Cerner. I'll be representing the PCP within this scenario. Now, George's journey continues as he visits his PCP, his new PCP, for the very first time. During this visit, the provider is able to pull data from multiple sources. Looking at my screen right now, you can see why. Because this product, Cerner PowerChart, is able to access Commonwealth's Record Locator service to see all the sources and all the locations that George has been to in the past. Now, going further into Cerner PowerChart, you're able to see that there's data from disparate systems coming into the summary view, in addition to unstructured data about the plan of care. If I was interested as a provider in also reconciling or consuming discrete data items coming from external sources, I'm able to do it this way. All the items that have the purple diamond are items that come from outside locations. But then you have other local records that have been charted from within the system. Going back to George, during his encounter, unfortunately, he wasn't doing as well as he could have or should have been doing. And so the provider was advised to bump up his medications. In consultation with his home health as well, the provider was told to refer or recommend a new blood glucose machine for George. In order to do that, I can go to the Message Center application to send a secure direct message to the HME. This is one that we shared earlier, and as you can see, there's information pertinent to George's visit, a referral note, the actual CCD, and any other information that's needed. Another thing noteworthy is at the end of this encounter, an event notification will be sent to any other Commonwealth subscriber for event notifications, alerting them on George's journey. As a little recap, being able to show you patient matching within Commonwealth's record locator service, some document query, document retrieval, then event notifications, and secure direct messaging. At this point, I'm going to pass it to Courtney, who is representing the HME.
Thank you, Jonathan. So my name is Courtney Thomas. I am with Brightree, and I'm representing the HME in this use case scenario. So at this point in the process, we would have received a referral electronically via direct secure message from Cerner for George's glucose monitoring machine. Here it would land in my referral management work list in the HME's Brightree database. Once they open up that referral, they're going to be able to review the continuity of care document that came directly from Cerner. So this is going to have all of George's information. It's going to have his demographic information, it's going to have his medication history, as well as the referral for the equipment prescribed. At this point in the process, the HME is then able to use several different automation features built into the Brightree system to really streamline the intake process for this order. That process does start with a patient matching component where Brightree will automatically identify the patient record in our Brightree database that matches this referral based off of that information from the CCD document. If the system does not identify a patient match, it will automatically create a new patient record, really eliminating any data entry for our HME here today. As the HME processes this order, a PDF of this document would be stored in the patient record in the HME's Brightree database as well. Additionally, a sales order can also be automatically created so that the HME can schedule the delivery of George's glucose monitoring machine efficiently as possible. This also allows the HME to follow up for resupply purposes thereafter as well. And then, of course, once George has his new machine, he's able to monitor his glucose levels and follow up with his home health provider accordingly. So with that, I will turn it back over to Katie at Cerner.
Great. Thank you so much. Thank you to these interoperable services, systems, and networks. George's providers are able to coordinate his care across different providers, insurance plans, venues of care, health IT vendors, including records from a health system whose EHR provider may not be contributing to the Commonwealth services. George was also able to better manage his own care and become a more empowered patient thanks to his personal health record connected to the Commonwealth network, all of which resulted in a more positive outcome for George. Thank you.